Good day and welcome to your favorite health show, Ask the Doctor. I'm Ilo Ogonimu. Today on Ask the Doctor, we'll be looking at chlamydia. But before we talk more on chlamydia, let's go on our health tips. Wow viewers, hope you enjoyed that and hope you've been educated. To avoid dry skin, please do away with hot water. Our guest today is not that person, Dr. Shola Ayowole. He is the medical director of LLM Clinic and Maternity, Orunworu, Delta State, Nigeria. Well, doctor, you're welcome to the program.
Thank you.
So, doctor, what is chlamydia?
Well, chlamydial infection is a sexually transmitted infection.
Okay, STD.
Yeah, STD. Now, the organism chlamydia prefer living in woman cells. They live in woman cells.
Okay, but men can carry it.
Both male and female carries it. Okay, in fact, it affects the male more than the female. Male, normally we will transfer to women, but women carries it because the chlamydial organism itself prefer living in woman cells. They live in woman cells. That's where they live. Now, when a male or a female is infected with chlamydia, now we say chlamydia is a sexually transmitted infection or disease caused by chlamydial tracheomyitis. Okay. Chlamydial tracheomyitis. Now, the tracheomyitis is the complication. If not the chlamydia itself, the organism prefer living in woman cells. They can live in woman cells in many years without complication. Chlamydia does not cause you symptoms until it starts destroying your body systems. It damages the body systems. So because they prefer living in woman cells, so it affects both male and female. In fact, most people that it affects is even the male.
So how common?
Yeah. Now the organism, I know there are so many things that troubles with Africans. We have so many organisms. Now this organism lives in woman cells. What it does, without causing the patient any symptoms, no sign.
But it's doing it.
It's gradually.
Okay.
By the time it starts causing you symptoms, know that it has damaged part of your body systems, like the urethra.
Okay, before we talk about the symptoms, are there types?
Chlamydia, is not well known in this part of
it's not common. It's not common
in this part of our
of Africa.
But it has been said that over 4 million in 1995, over 2,000 million, over 4 million, I beg your pardon, over 4 million people were affected of chlamydia. So technically, we know that we travel abroad also, and also people abroad comes to the side, and so the male are the most people that are affected by chlamydial bacteria or chlamydial organism.
Okay.
Yeah.
Before we talk more on the dangers it causes to the body, you said it's an STD, as in sexual transmitted.
It's sexually transmitted.
Apart from sex, is there any way someone can contact it? Yes.
Yes. Apart from sex, one can contact it by kissing.
Wow.
Yes. You contact it by kissing. You contact it by
handshake.
No, it's organism. It's not. It doesn't really go through the bloodstream per se. Now, if somebody is having it, you can contact it through handshake. Chlamydia. So not necessarily sex. You can contact it through handshake. You can contact it through eye because it also affects the eye, causing what we call the trachoma. When it affects the eye, it affects the genitals. I will get into that. It affects the eye, then kissing, then handshake. You will contact it through handshake because it's in fingers. You can get. That's why it's always good to maintain your fingers. maintain your finger very well. So you can contact it through the fingers, through eye-to-eye look, because it affects the eye. It is the major cause of blindness, chlamydia. It is the major cause of blindness.
Okay. What about using the personal belongings to someone that has been affected? Does it like?
Of course, just like sharing of a towel. Towel. The most bacterials they breed in cold, in a damp condition. So if you share clothing like towels now, using the same towel with someone who has been affected, you will be affected also. Towels, handshake, eye-to-eye look. Apart from sex, apart from anal sex, oral sex, or vaginal sex.
Someone can still get you through anal sex.
Anal sex, you can get it through anal sex.
Or oral sex.
Oral sex, get it through oral sex. So it's sexually transmitted disease.
One of your if you just joined us, the program is Ask the Doctor, and we've been looking at chlamydia. But before we talk more on this chlamydia, let's go on a short break. More of this when we return.
Hello boss, you have one text message. Hello boss, you have one text message. You have a text message. Hello boss, you have one text message. Hello boss, you have one text message. You have a text message.
Enzyme from African Broadcasting Network.
To the Daughters of Sarah and Family Agent Series, Stella Calabi is my name.
Keep watching ABN Sports. It's a clash of the titans.
You don't serve a dead God. You serve a living God. He is the same yesterday.
Well, wherever you are watching, this is Mama Helen Angel, all the way from Warri, Nigeria today.
ABN News.
At this time.
Welcome to Sunrise Eagles Devotional.
Velvet Room. Now, you can hear it from the mouth of the icons themselves.
Are you a kid or a teenager? If yes, looking for something captivating?
Hello there. You're welcome once again to another episode of Health and Fitness.
Sit down with entrepreneurs and they encourage you on how to develop your own entrepreneurship business. Keep watching. Let's talk.
Welcome back. If you just joined us, the program is Ask the Doctor. For sponsorship and adverts, please do call the numbers on your screen. Or if you want to participate, or if you have a question on this topic or any other health related issue, just give us a call. Well, doctor, apart from the blindness you mentioned, what are other symptoms?
Yes, there are many symptoms. Like now, in the male, it can bring about what we call urethritis. Urethritis simply means inflammation of the urethra, making the man to have what a whitish discharging.
Is it true during sex, discharge during sex?
No, not or when you want to urinate. You see, the person will just be by passing out a white discharge from the penis, like a pus. So that's one of the sign. Okay. And then the symptoms, it has to do with the painful, prostatitis, the testicles, just testicles that forms the sperm. Painful, those are the symptoms. Painful testicles in male, but in female.
Is it like gonorrhea?
Chlamydia is we call it non-gonococcal genital infection.
Oh, okay.
Non-gonococcal genital infection. Okay. It's like gonorrhea, but it's different from gonorrhea. So it's called non-gonococcal genital infection, not gonorrhea itself. So in male, it causes urethritis, making the male to discharge white substance. do you know that the person have been infected with chlamydia?
Okay, that's in male.
In male.
Okay.
Then in female, it doesn't cost before a female will begin to have the symptoms, it takes a very long time.
So what are
than
the
male.
symptoms?
The symptoms are, PID, pelvic inflammatory disease.
Okay.
Cervix, the cervix will be infected. The cervix, when the cervix is infected, it will affect the womb itself, which we call the uterus. The womb will be affected. Then it has also affected the fallopian tubes. When the cervix have been affected, the woman will be having serious abdominal pain. Then sometimes we will be having discharge. It will be discharging as if it's menstruating. It's not normal menstruation. It's just caused by the organism.
Is it like a blood?
Blood having bloody discharge from the vagina. All these are the signs and the symptoms. When a woman is not supposed to be menstruating, and sometimes you see your menstrues and you see your menstrues often, please go for checkup. See if you have been infected with chlamydia, because it makes a woman to menstruate when she's not supposed to be menstruating.
And the woman will think she's menstruating.
She's menstruating.
Wow. Yeah. So between the different stages you just mentioned, is there any signs? Are they different?
Between the stages?
The early stage and the late stage.
The early stage, it has to do with serious abdominal crampy sensation, abdominal pain. These are the early stage. But like I told you, I said chlamydia does not cause the patient, symptoms early until it has been in the body system for years.
Okay. Does it affect a mother?
Yes, it affects a mother during pregnancy. Yes, let us say it can cause about sterility, making the mother not to be able to become pregnant. It can cause sterility. So, but if the woman have already been pregnant and is having chlamydia, it will affect the baby also.
Okay. So let's go to treatment now. Is there a treatment for it?
There's very, very good treatment. But I always say treatment during pregnancy is not always advisable by us. It's dangerous. That's why it's always good, before you get pregnant, go for regular checkup. Go for proper medical checkup to save your baby complications and to save you having complications during pregnancy. So it's always advisable to go for checkup before you get pregnant. But if you are already pregnant and you are infected, you could also be treated. There are vaccines you'll be given, but you must go for early antenatal so that they detect the bacteria or the organism in you much early, before it causes damage to the growing baby.
Okay, Doctor, before we talk more on this, before we talk about the prevention, because you've told us about the cause, the early stages, the signs and symptoms. Yeah. So before we talk more on now is a prevention, because you've told us about treatment, that you don't advise women to get treated when they are pregnant. Yeah. So before we talk more on the treatment, before we talk about the prevention, let's go on a short break. One of you, as if you just joined us, the program is Ask the Doctor. Now we're going straight to our nutritional value segment, where we'll be telling you more about lemon water.
Hey everyone, there are many health benefits of lemons that have been known for centuries. The two biggest are lemon's strong antibacterial, antiviral, and immune-boosting powers, and their use as a weight loss aid, because lemon juice is a digestive aid and liver cleanser. Lemons contain many substances, notably citric acid, calcium, magnesium, vitamin C, bioflavonoids, pectin, and limonene that promote immunity and fight infection. Lemon water in the morning helps kickstart the digestion process for the day. And just remember, choices that you make regarding your daily routine either build up resistance to disease or tear it down. How to do it. I like using purified water, and it should be room temperature. You can also go with lukewarm and not scalding hot, obviously, but you want to avoid ice cold water since that can be a lot for your body to process. Plus, it takes more energy to process ice cold water than room temperature. I always use fresh lemons, organic if possible, never bottled lemon juice. If the lemon is small, I usually cut that in half and I will squeeze half a lemon into a glass. If the lemon is larger, I will cut 3 wedges from that lemon and squeeze those 3 into the glass. I also like to pre-cut wedges in advance, that way I could just easily squeeze them in the morning. And remember, drink it down first thing before you eat or work out, go to work, etc., etc. Lemon juice flushes out unwanted materials and toxins from the body. Its atomic composition is similar to saliva and the hydrochloric acid of digestive juices. Number 2. Cleanses your system and is a diuretic. Lemon juice helps flush out unwanted materials in part because lemons increase the rate of urination in the body. Therefore, toxins are released at a faster rate, which helps keep your urinary tract healthy. The citric acid in lemons helps maximize enzyme function, which stimulates the liver and aids in detoxification. Awesome. Number 3. Boosts your immune system. Lemons are high in vitamin C, which is great for fighting colds. They're high in potassium, which stimulates brain and nerve function. Potassium also helps control blood pressure. The ascorbic acid, aka vitamin C, found in lemons demonstrates anti-inflammatory effects and is used as complementary support for asthma and other respiratory symptoms. Plus, it enhances iron absorption in the body, and iron plays an important role in immune function. Lemons also contain saponins, which show antimicrobial properties that may help keep cold and flu at bay. Lemons also reduce the amount of phlegm produced by the body. Number 4. Balances pH levels. Lemons are one of the most alkalizing foods for the body. Sure, they are acidic on their own, but inside our bodies they're alkaline. Lemons contain both citric and ascorbic acid. Weak acids easily metabolize from the body, allowing the mineral content of lemons to help alkalize the blood. Disease states only occur when the body pH is acidic. Drinking lemon water regularly can help to remove overall acidity in the body, including uric acid in the joints, which is one of the primary causes of pain and inflammation. Number 5. Clear skin. The vitamin C component, as well as other antioxidants, helps decrease wrinkles and blemishes, and it helps to combat free radical damage. Vitamin C is vital for healthy glowing skin, while its alkaline nature kills some types of bacteria known to cause acne. It can actually be applied directly to scars or age spots to help reduce their appearance. Since lemon water purges toxins from your blood, it would also be helping to keep your skin clear of blemishes from the inside out. The vitamin C contained in the lemon rejuvenates the skin from within your body. Number 6. Energizes you and enhances your mood. Fun fact: the energy a human receives from food comes from the atoms and molecules in your food. A reaction occurs when the positive charged ions from food enter the digestive tract and interact with the negative charged enzymes. Lemon is one of the few foods that contain more negative charged ions, providing your body with more energy when it enters the digestive tract. The scent of lemon also has a mood-enhancing and energizing property. The smell of lemon juice can brighten your mood and help clear your mind. Lemon can also help reduce anxiety and depression. Number 7. Promotes healing. Vitamin C, found in abundance in lemons, promotes wound healing and is an essential nutrient in the maintenance of healthy bones, connective tissue, and cartilage. As noted previously, vitamin C also displays anti-inflammatory properties. Combined, vitamin C is an essential nutrient in the maintenance of good health and recovery from stress and injury. Number 8. Freshens Breath. Besides fresher breath, lemons have been known to help relieve tooth pain and gingivitis. Be aware that citric acid can erode tooth enamel, so you should be mindful of this. No, not brush your teeth just after drinking your lemon water. It is best to brush your teeth first, then drink your lemon water, or wait a significant amount of time after to brush your teeth. Furthermore, you can rinse your mouth with purified water after you finish your lemon water. Number 9. Hydrates your lymph system. Lemon water helps support the immune system by hydrating and replacing fluids lost by your body. When your body is deprived of water, you can definitely feel the side effects, which include feeling tired, sluggish, decreased immune function, constipation, lack of energy, low, high blood pressure, lack of sleep, lack of mental clarity, and feeling stressed, just to name a few. And lastly, number 10, aids in weight loss. Lemons are high in pectin fiber, which helps fight hunger cravings. Studies have shown people who maintain a more alkaline diet do in fact lose weight faster. I personally find myself making better choices throughout the day if I start my day off right by making a health-conscious choice to drink lemon water first thing every morning. Not only are the benefits of drinking lemon water endless, it's one of the most substantial yet simple changes you can make towards improving your health.
Wow, viewers, I know you enjoyed our health tips, but we are still with our doctor. Well, if lemon can clean your body system, I advise you continue taking lemon. Well, doctor, you made mention of pregnant women. You said when they are, you don't advise treatment when they are pregnant. Yeah. What about those that are not pregnant?
Yes, there are very good treatment for chlamydia, trichomyiasis. Trichomyiasis. Okay. That is the complications. So there are very good treatment for it. There are good antibiotics for it if you are not pregnant. Like I said when I was talking about vaginal infection, I said when you are pregnant, you don't take anything antibiotic. It is dangerous to the growing fetus, the growing baby. It's dangerous. So there are drugs we give, doctor we give. So that's why it's always advisable to go for early antenatal care. So that, like if you come to my hospital now, the first thing I do is to carry out tests for you. I run all kind of tests for you, different tests, to know whether you have been infected, to know whether you are, I want to screen you, to know about your HIV status, everything we do. Now, if a woman is infected with some bacteria during pregnancy, there are treatments, there are vaccines we give so that the baby will not be affected. Not drugs, it's injections. That's why you need to meet a professional that will give you vaccines so that the baby will be prevented from the disease.
Okay. What about those that are not?
Those that are not pregnant, there are good antibiotics you take. You come, once it has been detected that you are carrying chlamydia bacterial or organism, there are good antibiotics to take that will cure you. You have a cure. Okay. It can cure you. It's a curable disease. And there are good drugs that will cleanse you off of it entirely.
Okay. What about using of birth control pills? Does it increase the chances?
It depends on the device you are using. Depending on the device, because if you are using the oral birth control, the oral birth control, or if it is if it's oral birth control you are using, it increases the chances of becoming infected. If you are using oral birth control. But if it is the coil, I use the coil, we call it the IUC, this coil, that one has no side effect as such because it has nothing to do with medication. But you need to go for every 3 months you go for checkup, because if you do not go for checkup, if the coil is inserted into your cervix and you don't go for regular checkup, you could also be infected again by the coil.
Okay, so
which will increase your chances of becoming, prone to bacteria.
Okay, so what are the preventive measures and what's your advice to the public?
What advice is this? My advice is that everyone, I think by now we are in a modern age where everyone should be a Christian. The first preventive is you keep a safe sex. You stick to one sexual partner because it's a sexually transmitted infection. You stick to one sexual partner. Then if you know, and you make sure you insist to know the history of your sexual partner, insist to know as a sexual history. It's so very, very important. Before you get into a relationship, you insist to know your partner's sexual history. To know if he has been very active sexually, you know. Then if he has been very active sexually, or she has been very active sexually, then insist that some checkup should be carried out before you get into any relationship. Then please maintain a very good hygienic condition. Like I told you, this chlamydia you could be infected with it with just eye to eye because it affects the eye also. It causes arthritis also. So handshake also, because the chlamydia organism could affect you by handshaking. It's in there, not just necessarily the blood system. So you can have the handshaking. So I advise you maintain a very good and clean hygienic condition for you not to be infected with chlamydia. Thank you.
Well, since chlamydia is an STD, as in sexual transmitted disease, it is advised you stick to your partner. And if you are not married, please, abstinence is the best. And doctors said that we should be hygienic conscious, as in we should be conscious of our hygiene, should be clean, and neatness is next to godliness. Well, doctor, thank you very much for being our guest today. Well, if you just joined us, the program is Ask the Doctor. Thank you very much for being there for us. Without you, we will not be here today. I'm Ilo Ogonimu saying health is wealth. So take very good care of yourself. and live a healthy life. Ciao, ciao.